Thanks so much for having me here to talk with you today about the connections between climate change and our health and how we can engage in solutions. My name is Rebecca Rehr, and I'm the Director of Climate for Health at EcoAmerica. EcoAmerica is a nonpartisan, nonprofit organization working to build public support and political resolve for climate solutions in the US by engaging the trusted sectors that Americans look to for guidance and direction, including and importantly, the health sector. Climate for Health is the health program of EcoAmerica. We are a national initiative led by a diverse network of health leaders and organizations designed to empower health professionals to speak about, act on, and advocate for climate solutions that protect personal and community health. I am here today to help empower you to make a difference by helping you make the connection between climate and health, discuss ideas and resources to take action at home and in your community, make sure you feel comfortable sharing this with others, and inviting others to take action with you on equitable climate solutions. Before we jump in, I wanted to ask you to think about what brings you here today and what you hope to learn. So just take a moment and jot this down. If you're comfortable, type it into the chat so we can start to get to know each other a little bit through chat. The primary impact of all of our carbon pollution is that the Earth is getting warmer. This animation from NASA illustrates how our planet has warmed since 1880, about when we started burning fossil fuels at scale. It warms slowly at first, but as we burn, it warms much more rapidly over the past couple of decades, which you're seeing right now. 2011 to 2020 was the warmest decade on record in a persistent long-term climate change trend. The warmest 6 years on record have all been very recent, with 2016, 19, and 20 being the top three. We've been burning more and more fossil fuels over the years. What you see on the slides now, the graph at the top left shows our 40-fold increase in emissions since 1920 from burning solid, liquid, and gas fossil fuels. The graph in the lower left shows the increase in planetary temperatures over the past century, about 3 degrees Fahrenheit. Those warmer temperatures are causing ever more climate and weather disasters, which you can see in the graph on the right. More and larger wildfires, floods, storms, and droughts that we're noticing all around us. And from 1980 to 2015, America averaged $6 billion climate or weather disasters a year, inflation adjusted. So where are climate changes and disasters impacting us? In 2020, there were 22 unique or individual weather or climate disaster events with losses exceeding $1 billion each to affect the United States, shattering the previous annual record of 16 events that occurred in both 2011 and 2017. 2020 was the 6th consecutive year in which 10 or more billion-dollar weather and climate disaster events have impacted the United States. You can see the severe storms, hurricanes, and tornadoes in the South and the Midwest. Wildfires out west are lasting weeks to months, burning forests and towns over many millions of acres. The droughts in the Southwest are lasting for years and setting new records for duration and damage. Overall, these have massive economic effects, from damage to property values to loss of infrastructure and jobs in the areas that are impacted, which you can see on the map. Global warming pollution is caused primarily by one thing: people burning fossil fuels for heat and energy. When we burn fossil fuels, gas, coal, and methane, it produces greenhouse gas emissions, primarily carbon dioxide or CO2. These are heat trapping gases, so it's as if we're wrapping a heavy blanket around the planet, as we saw the effects in that NASA video. In the United States, there are 5 major contributors of carbon dioxide. Transportation is responsible for the largest share, 29%, burning fossil fuel for cars, trucks, ships, trains, and planes. Electricity production generates another 28%. We've been shifting to renewable energy over the past decade, but about 63% of our electricity still comes from burning coal and methane. 22% comes from industry burning fossil fuels, mostly to make things like steel, aluminum, and concrete. Emissions from businesses and homes are another 12%. And agriculture emissions from livestock, agricultural soils is the remaining 9% in the US. It's also worth mentioning that all these processes emit But there are also industrial processes we engage in, like deforestation, which removes the Earth's natural capacity to remove carbon from the atmosphere. This is a dangerous feedback loop, and we'll cover that a bit more when we get into solutions later. It's also worth mentioning that there are other very potent greenhouse gases like methane that are very harmful to our health. But the main message here is burning fossil fuels in these areas is the main contributor to our changing climate. So right here in Silver Spring, where I live, there's lots of biking and walking trails, and I've definitely been utilizing them a lot more during the pandemic than I was pre-pandemic to get my exercise. Whereas before I might have gone to a gym and been inside with a bunch of people. Now I much prefer to go on walks every day, take bike rides. But the allergy seasons in this area are much longer and more severe. So it's something I consider and is actually impacting the way sort of when I can exercise or how I exercise or whether I'm feeling up to it, depending on the pollen count outside. I can hop on my bike, but I start like tearing immediately. So, it's not just these, it's close to home and these climate impacts are really impacting us directly. And so thanks for letting me share a little bit about how I'm impacted in Silver Spring. And it's also important to know that climate change harms some more than others. A new EPA report shows that the most severe harms from climate change fall disproportionately on underserved communities who are least able to prepare for and recover from heat waves, poor air quality, flooding, and other impacts. EPA's analysis indicates that racial and ethnic minority communities are particularly vulnerable to the greatest impacts of climate change. People are at risk of experiencing climate change impacts when they are both exposed and vulnerable to climate hazards. So, for example, think about those with low income or no high school diploma. They're approximately 25% more likely than non-low income individuals and those with a high school diploma to live in areas with the highest projected losses of labor hours due to increases in high temperature days with 2 degrees Celsius of global warming. So to switch gears a little bit and start setting our groundwork for building climate understanding and climate and health leadership, let's look at where Americans are generally on this issue. And it turns out more Americans are concerned than you may think. And this should encourage us in our work to open dialogue. Eco America's research shows that 79% of Americans are concerned about climate, with 48% being very concerned. But despite the high level of concern, only 59% of Americans believe others around them are concerned. And importantly, more than twice as many people are very concerned than they believe to be the case with others. What this means in practice is that most Americans feel alone in their concern about climate change. And the gap in actual versus perceived climate concern might be contributing to silence on the issue and points to the increasingly urgent need for visible leadership and public discourse. So instead of anticipating resistance, if you want to talk about this, the data really shows that your next audience has been waiting to hear from you. And in 2020, in a survey done in early 2021 from Eco America, health even surpassed jobs as the motivation to act on climate. 76% of Americans said they would support climate solutions that protect personal and public health, while 71% say they would support climate solutions that increase good paying jobs. Roughly half say strengthening our communities and advancing justice and equity. So it's critical that we make the connection clear between climate solutions and health benefits, which I hope you'll be able to do more effectively after chatting and going through this talk. So to summarize the climate story succinctly, which is exactly what we hope that everybody here can do moving forward. So first, warming of the climate system is unequivocal. Atmospheric concentrations of carbon dioxide, methane, and nitrous oxides have increased to unprecedented levels, and the role of humans is indisputable. Extracting and burning fossil fuels for energy is the root cause of this rapidly changing climate and has implications for acute and inequitable respiratory effects as well. Climate change harms some more than others, often rooted in systems of racism and injustice. And here's the key. The overall risks of climate change impacts can be reduced by limiting the rate and magnitude of climate change. We have time to act. And next, we're going to talk a little bit more about the health impacts of climate change. So I'm going to we're not going to get into necessarily all of these impacts, but I really do want everybody here to know that climate change impacts our health in a number of ways. Higher temperatures are happening more often and in places where we didn't see them before. Extreme weather can hurt people right away and also have longer lasting impacts. Bugs that carry diseases are found in new places. And no matter what we're facing, there's always going to be populations more vulnerable to these changes. And there are also harms deeper than physical that can impact our mental health and well-being. This infographic from the US Global Change Research Program illustrates the social determinants of health framework applied to populations that can be disproportionately impacted by climate change. While climate change affects all of us, communities experiencing poverty and under-resourced communities, communities of color, people with chronic disease or disability, children, and older adults are some of the most at risk. Race and ethnicity, socioeconomic status, age, and education can actually impact a person or a community's ability to respond to environmental exposures, including climate change. In this country, your zip code has a greater impact on your life expectancy than your genetic code. Think about a community living near a polluting facility, like a coal-burning power plant or an incinerator, more often than not a Black or brown community. Pollution from that facility will be concentrated nearby, and as climate change worsens, so does that air pollution. Therefore, climate solutions present an opportunity to build health equity into our policies and practices at all levels. Promoting equitable climate and clean energy solutions will create a more healthy and prosperous future for everyone. So just to dig into a few of the climate impacts, starting with heat-related deaths and illnesses. Heat can impact our health in a number of ways. When it's hot, our bodies are under a lot of distress. Prolonged exposure to high temperatures is associated with increased hospital admissions for cardiovascular, kidney, and respiratory disorders, and excessive heat can increase adverse birth outcomes. Elevated heat, especially along with high humidity, makes it difficult for the body to cool itself. If it's both hot and humid outside, which it definitely is in the summers where I am in Silver Spring, your body actually loses the ability to cool itself down because your sweat can't evaporate if the air is already saturated with water. By the end of the century, heat-related deaths are projected to increase on the order of thousands to then tens of thousands each year in the US. And I wanted to make sure I covered allergens since I mentioned it earlier and it's part of my own personal story. The data backs up what I'm experiencing here. Allergenic pollen seasons last 20 days longer than 30 years ago. Pollen concentrations are up more than 20% across North America. And so I'm just to demonstrate how the data bears out what I was saying. The only other health impact I wanted to touch on, because it impacts my region as well, is vector-borne disease. Climate change has expanded habitat ranges, reproductive rate, and metabolism for vectors such as mosquitoes or ticks that can carry pathogens. The number of illnesses caused by mosquito, tick, and flea bites have tripled in the United States over the last few years. And mosquitoes are one of the most prominent carriers for tropical diseases. And more than 20 major US cities have ideal climate conditions for mosquitoes at least 200 days each year. The Aedes aegypti mosquito is the principal vector that spreads dengue fever, chikungunya, Zika fever, and yellow fever. So, I mentioned that there's a lot more health impacts, but that's really what I wanted to cover today because it impacts me, and I can speak about it. I can tell you what's happening. And I hope that when all of you go talk to others about this, you're able to weave in sort of the way that climate change is impacting you personally. And one of the ways it's impacting all of us is through the health costs of climate change. And this infographic is from a 2021 report, which led with the finding that health costs from climate change and fossil fuel pollution tops $820 billion per year. Medical treatment and recovery from the many types of health problems worsened by climate change is expensive and burdens patients, employers, the public and private insurers, and health system operators. Extreme weather events commonly require people to seek medical care in emergency rooms, hospitals, and non-emergency healthcare settings. When patients are admitted to a hospital to treat severe illness and injuries, they may also forego income at work, triggering hardship for themselves and their families. The cost can continue to add up once patients are discharged from hospitals because of the possible need for ongoing outpatient care and medications. And please note that these are just the health costs of inaction. There are further costs related to infrastructure, for example. And all of the physical health impacts of climate change interconnect with mental health. Immediate and long-term impacts of climate change on the environment, society, and infrastructure can also lead to trauma, shock, stress, anxiety, and depression. Also, not all Americans are affected equally. There are certain vulnerabilities that exacerbate mental health impacts. We've talked a lot about inequity, so I want to make sure to define climate justice, which is seeking to ensure climate solutions are created by, for, and are equitably achieved, beneficial to, and just for all people, and especially for those who are least responsible for climate change, but most directly impacted. As we understand and talk about climate change, we must center justice as an issue of civil rights and of the people and communities most vulnerable to climate impacts, not just the environmental degradation itself. This is about people. Health professionals work across disciplines to treat and prevent harm to individuals and communities. Achieving health equity is a leading tenet of healthcare and public health work, and centering equity in climate solutions is a principal way to achieve health equity. To go further and define environmental justice, the federal definition of environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. Climate justice is a type of environmental justice, and both are rooted in racial justice. There has been growing support recently, especially for a federal response to environmental justice. In part, because of this growing support, some may think of environmental justice as a newer discipline or a movement or a newer movement, when in fact the work has been going on for decades and was born out of the civil rights movement. In 1982, in Warren County, North Carolina, residents of the predominantly Black community protested the siting of a hazardous landfill, as there were no environmental or geological reasons the land should host the landfill, only sociodemographic and political ones. In the mid to late 80s, a series of reports, including from the federal government's General Accountability Office and the United Church of Christ, found the disproportionate siting of polluting facilities in Black communities. Action followed in the 1990s with the 17 principles of environmental justice that were drafted at the first National People of Color Environmental Leadership Summit, held in October 1991 in Washington, D.C. The Office of Environmental Justice at the EPA was established in 1992. And Executive Order 12898 was signed by President Clinton in 1994, which directs each federal agency to make achieving environmental justice part of its mission by identifying and addressing disproportionately high and adverse human health or environmental effects of its programs, policies, and activities on minority populations and low-income populations. All of these efforts, creating safe and healthy environments for everyone, are rooted in health equity. With cleaner air and water, we are offering everyone opportunities to achieve their full potentials and to thrive. So now that we've covered health impacts and health equity and rooting solutions in climate and environmental justice, let's dive in more into solutions. There is so much we all can do every day to implement solutions. And just as there were major categories of emissions, which is the problem, there are also major categories of solutions, including clean energy, which includes wind and solar. Also included in this category can be hydroelectric, geothermal, and others such as solar thermal. Energy efficiency is another category, and it includes large-scale efficiency in buildings and the electric grid. Natural solutions include reforestation, greening of infrastructure, native planting, low emissions farming techniques, biocarbon, and many others. Climate policy includes regulations, performance standards, incentives, and market-based mechanisms. Community choice energy is an example of local climate policy that is providing both climate and economic benefits. So transportation, another category of solutions, include high miles per gallon and electric vehicles, more efficient air, train, and shipping methods, and public and active transportation. Personal behaviors includes a mixture of all of the above on a personal scale, plus consumption and waste reduction, that active transportation, sort of a personal choice, and diet choices as well. So in the last module, I spoke about climate change having disproportionate impacts when we're talking about health. All the ways that climate change makes our lives less stable, less secure, and less fair. So it follows that addressing climate change brings a raft of really needed benefits. Climate solutions save money, create good paying jobs, and clean our air and water. Those changes will make us healthier, more prosperous, and safer, and they result in a fairer and more equitable society. We pay for climate or carbon pollution well beyond the gas pump. Coal, oil, and gas fuels harm nature, our health, and cause wars. The brunt of these costs and problems are felt by vulnerable people who live closer to pollution. So let's talk a little bit more about energy efficiency. Improving energy efficiency is the cheapest and often most immediate way to reduce the use of fossil fuels. There are enormous opportunities for efficiency improvements in every sector of the economy, whether it's buildings, transportation, industry, or energy generation. The US Department of Energy estimates that implementing energy efficiency can help reduce use and therefore emissions and energy bills by up to 30%. The chart here shows the vast array of energy efficiency options just in our homes and buildings. Improving energy efficiency has a myriad of health benefits. Energy savings reduces pollution for our air, water, and climate. The dramatic shift from polluting fossil fuels to clean energy in utility scale electricity is happening in transportation too. Transportation is the largest contributor, as you may remember from earlier, to climate pollution in America at that 29% level. So more efficient transportation is a very effective way to mitigate climate change. From public transit to electrification of cars, buses, scooters, and bikes, ride and bike sharing, and active transportation, purchase and use of electric vehicles are experiencing exponential growth, while traditional internal combustion engines are in terminal decline. Clean transport benefits include reduced air pollution, traffic congestion, and road fatalities, and greater social cohesion. We also have huge potential to address climate change and improve health through natural solutions. As the chart shows, in the US, nature has the potential to remove 21% of our carbon pollution, which is equivalent to removing emissions from all cars and trucks currently on the road. The benefits of natural solutions and restoration are vast. They restore forests, enhance biodiversity, restore habitats, protect soil erosion, make our air cleaner and purer, and protect against flooding and storms, which reverse the multitude of negative effects caused or exacerbated by climate change. We're happier and less stressed when we spend time in nature. This is why I like the trails near my house and the bike rides and the walks that I take. By replanting our forests, we're helping to make more space for you, for us to find peace of mind. So, where can we implement these solutions? We can make a difference in many ways by living our values to protect both our health and our climate. And by protecting climate, protects our health. And we can do this in our homes, our workplaces, and in our broader communities. So at home, we can do a lot. Things like reducing our waste and consuming wisely go a long way. Consider borrowing or reusing items or purchasing secondhand. Think twice before buying single-use plastic when purchasing new items, and look for ones that are made from recycled or sustainable materials and energy efficient when possible. Recycle and compost whatever you can. Combining these last two talking points, what I've done in my neighborhood is actually joined a group called Buy Nothing, where folks, instead of going to look for something new or buying something in the neighborhood, if somebody has an item that they're no longer using, they'll share it with a neighbor, they'll give it to a neighbor. And so it's a way to get rid of things that you're not using anymore, but also get things without buying something new. And I actually got a compost turner from that group from a neighbor who just wasn't using it. So I've been able to start composting in my backyard with my food scraps with use from something from a neighbor that they weren't using anymore. So it's sort of living those values at home, and there are tools and resources at your fingertips to make that possible. Other things you can do include making sure your tires are filled, because low tire pressure makes us use more gas. Bike or take public transportation when possible. Walk or use another form of active transportation. When making home improvements, use energy efficient appliances like all electric stoves versus gas, and unplug electronics when they're not in use. Even small things like reusable bags and reusable water bottles makes a difference. And I have to say, when I'm out using mine, I've gotten compliments on I have reusable sandwich baggies too. I've tried to move away from single-use plastic bags, not just for the grocery store, but also for snacks. I'm a big snacker. And so I have a collection, that I use of these reusable sandwich bags as well. And people compliment me because they've never seen that before. So, by living your values, you can really show that education for others and inspire others to do the same. And I'll just mention personal, at home, don't forget to vote because we know we need systemic change. Local, state, and federal policies make it easier or harder for us to live more sustainably at home. And for everyone to have access to these initiatives and products, we need to vote for that systemic change. So in the Climate for Health Moving Forward guide, which you can find on our website, we include a roadmap to 100% clean energy. We break down a path to clean energy in a way that hopefully makes it easier to realize these goals on the timeline we need. All of these steps, taking a baseline, conservation, improvements, clean energy, and offsets apply across levels. So you can do this at home, and you can do this in your workplace and community, which we'll get into in just a minute. And so it's really important to be able to use this roadmap to break it down into smaller steps and to use it across levels. And so getting into workplace a little bit, perhaps you don't work in a healthcare setting. I consider myself a health professional, but I don't see patients every day. But maybe you do. And it's important to recognize, and the healthcare sector does recognize its contributions to climate change in its operations. In 2018, the healthcare sector was responsible for 8.5% of US greenhouse gas emissions and the loss of 388,000 disability adjusted life years. US healthcare greenhouse gas emissions rose 6% from 2010 to 2018 and are the highest per capita in the world. If the US healthcare system were ranked as a nation, it would rank 13th in the world for emissions, more than the entire UK. 82% of healthcare emissions are from the supply chain: food, pharmaceuticals, chemicals, medical devices, and supplies. And we know this is a conversation on the global stage right now. And the US joined other national countries to commit to decarbonizing the healthcare sector because we recognize the impact that emissions within the healthcare system are having on our health. And so we wanted to, just give an example of a hospital that is taking action, which is Dell Children's Hospital. In 2008, Dell Children's Hospital in Austin, Texas, became the world's first leadership in energy and environmental design, which you may have heard of as LEED, platinum certified hospital. In 2013, a new addition to the hospital became the first ever LEED for Healthcare Platinum designation. The LEED healthcare certification combines 5 key areas: sustainable development, water savings, energy efficiency, material selection, and indoor environmental air quality, with the unique attributes and specifications of healthcare facilities. So even though the hospital set high sustainability standards during construction, the cost of construction remained equivalent to that of other hospitals being built in the area at the time. Financial successes also come from patient satisfaction and lower staff turnover. The national average for nursing turnover rate ranges from 10 to 15% and can be as high as 30% in a new hospital during the first year. But Dell Children's Hospital had a first-year nurse turnover rate of just 2.4%. The building has 6 internal courtyards that provide daylight, fresh air, views, and access to nature that contribute to the healing environment that improves patient outcomes and plays a role in improving productivity and recruiting and retaining doctors and nursing staff. So I'm in public health. I'm a public health professional. So I also wanted to make sure to talk about public health solutions. So this healthcare, public health, I'm sure if you're a different specialty, there's solutions happening in your sector too. And I encourage you to get engaged. But just as an example from the public health sector, the American Public Health Association has made a commitment to move towards 100% clean energy in their operations by 2030. They also declared 2017 the year of climate change and health, kicking off a year of intensive education, programmatic and resource offering, and a national convention dedicated to those themes. And they also recently launched the Center for Climate, Health, and Equity, which is active every year in their annual meeting, so that climate, health, and equity are topics throughout APHA's programming. So a third level where we can work is in our communities. Climate change is happening now. How do we prepare and adapt in order to minimize the impacts to ourselves, our families, and our communities? Thinking of how we can create a place of refuge in our communities in the face of climate change can be a powerful way to make a difference. Assemble a team to assess risks in your healthcare infrastructure and community and develop and implement plans. Set goals to guide you in your adaptation to climate change. Assess the specific risk facing your area. Develop a plan by exploring your options and prioritizing. Connect with your local health departments and relief agencies. Communicate your plan and update it annually, and implement your plan starting with the highest priority action. We talked about the power each of us has in our own lives, our workplaces, and our communities. We can and should do all that we can to act on climate in our individual spheres of influence. And as we take actions in our homes, workplaces, and communities, we must all work toward policy and systemic change so solutions can be accessible to all. And the way we can do that is through advocacy. So once you're plugged into climate and health as a priority and know the issue, let's start talking about it. Find audiences to share your perspective, concerns, and invite them to join you in action. This includes a spectrum of audiences from friends and family, colleagues, and in your professional settings, your local community, which includes government, business, and education. You can also talk to corporations, polluters in that category, and also policymakers. Climate advocacy involves a spectrum of activities appropriate for any level of advocate, whether you are seasoned or just getting started. And you can plug in at any level. This isn't necessarily a linear path. With family and friends, talking about climate change as a health issue and climate solutions as a moral imperative is critical. As we discussed previously, we know that 79% of Americans are concerned about climate change, but they think only 59% of people around them are concerned. And of that 79%, like we said, nearly half are very concerned, but when asked about others around them, only 23% of people say they're very concerned. So there's that half as many. But that's a gap that we can close by talking about this issue and connecting it with our common values and providing opportunities for our friends and families to do something about it. Make sure to highlight the solutions and benefits as we've discussed. Share resources so that they can also become more climate literate in their own advocacy journeys, and invite your network to join you in action. It's easier to get started when you know you're joining someone else already involved in this space. You should also engage your colleagues. Collaborate with other leaders within and beyond your field on position and goals for the community. Build on successes from your peers and give examples from similar professional associations. I tried to give the example of APHA earlier. And this will sound very familiar, but invite your network to join you in action. It's easier to get started when you know you're joining someone else already involved in this space. When it comes to your local community, educate your local leaders. Perhaps they're parents in the PTA or members of your congregation if you belong to one. Talk about the ways climate change is impacting your health and your family's health, and find that common ground on solutions with your community. Engage with advocacy activities with peers and with organizations. So programs, policy statements, actions, prioritize solutions that are inclusive. There's no need to reinvent the wheel if your community is already doing work on climate and health. Collaborate and join efforts. And next up, with policymakers, you can and should engage at the national, state, and local levels when possible. Start to build relationships with your policymakers. Connect with them, schedule in-person or virtual meetings, and write, call, or email them about your advocacy asks. Step forward as a climate and health champion. Build cross-sector initiatives to show the growing consensus for climate action. Attend summits and events with policymakers, including important hearings, candidate forums, town halls, and community engagement events. Make sure they are connecting the dots on climate solutions as health solutions. And since we're all in an online world now, I want to make sure I mention online advocacy. Social media really has revolutionized information, media, communications, marketing, sales, advocacy, and more. Some call it the democratization of information. Others curse it for not holding that information accountable. But there are many positive sides to social media. It can amplify your voice for free. It can gather supporters around a common cause. It can strengthen your message by bringing in more stories and voices. And during election season, policymakers are reading and responding. Most elected officials and executive branch leaders do have social media, and it's a great way to advocate with them and to publicly thank them for leading on initiatives that you support. You can be incredibly effective in engaging your community, friends, family, organizations, businesses, and more through effective use of social media. And don't forget the importance of voting. Vote your health and climate values at the local, state, and federal levels. Consider not just candidates, but the climate implications of ballot referendums. Consider candidate platforms, statements, records, and plans for climate solutions. And importantly, talk about the importance of voting for health and climate with others. An easy way to get started is by signing and participating in the Momentous campaign. Momentous is a collective campaign across civil society to implement bold, ambitious action and have carbon emissions each year moving forward. You can join this collective action by signing and joining yourselves and inviting others to join you too. You make a personal and organizational commitment to climate action, advocacy, and collective action that complies with the science to have emissions each decade going forward. There are over 200 charter signatories, including key faith institutions, health organizations, and local government leaders. So I want to talk a little bit about, so where I am and local, give an example of local advocacy opportunities so you know what might be available in your neck of the woods as well. So I am a member of the Maryland Public Health Association Advocacy Committee. I was actually chair of that committee for a couple years ago. And it's a great way. So the Maryland Public Health Association is the state affiliate of the American Public Health Association. And it is a great way to get involved locally. It's an all volunteer organization. So my getting involved gave me the opportunity to build up the climate and health voice, the public health voice on climate policy within the Maryland Public Health Association. And it was, it's been a wonderful experience. And even very recently, I actually called my own state delegates because the legislative session in Maryland is just around the corner. And you should also know when your state legislative session meets, it's not always the same in every state. They're quite different in different times of the year and different lengths of the session. But we met with my local delegate with a couple of members from the MDPHA Advocacy Committee to talk about, hey, what legislation do you have that you're going to introduce in the next legislative session? And what of those, my delegate does a lot of energy efficiency and sort of clean energy initiatives, especially incorporating low income household needs when it comes to energy and energy efficiency. And so we thought that might be a good intersection with public health initiatives. And so we met with my delegate, sort of me as a representative, sort of a constituent in her district, and so I was a vested interest, and I can vote for her, but also as an institution, as the Maryland Public Health Association, to be able to provide institutional weight and support for initiatives that she might introduce that are environment, at their core environmental health initiatives. And she met with us for 45 minutes. Really went through her legislative agenda, and we talked about what we might be able to support. It was a great meeting. And so I encourage all of you to take activities like that, just reach out to your local delegation and tell them of your interest and ask them what you might be able to support and open up those conversations. So the Maryland Public Health Association is one example of a powerful local organization. And I encourage you to find out what is in your locality as well. So as we reach the end of our time together, I'm curious, what have you learned? How can we improve? What might there be things that we improve in this presentation? I always love hearing feedback. I'd love to hear your personal action plan. What are you thinking about next? And if we can break into small groups, a group action plan, we'll see if there's time for that. So next steps, I would just encourage you all, stay connected with Climate for Health and Eco America on social media. On Twitter, we're at climate4health. And Eco America, you can get the latest information on climate and health by subscribing to our newsletter. I encourage you to seek climate leadership within your profession, deploy your skills and toolbox, and share your learning and knowledge. Other things you can do include writing op-eds or letters to the editor for newspapers and magazines. If you read an article about climate change and the article doesn't mention health, just write them a quick note to tell them every time you talk about climate change, please talk about health. Vote, encourage others to vote, organize advocacy events in your community, share climate news on social media, and bring your advocacy activities to your professional organizations. And don't forget to sign on to Momentous, ecoamerica.org/momentous. So thanks so much for having me. I appreciate all of you and hope to engage with you on climate and health leadership. Thanks for having me here today.